So could you talk about access to health services in the Amazon, why the region has been disproportionately affected, and also the accelerated rate of deforestation that's presently occurring, and how that's impacting the spread of the virus?
Yeah, that's a very important point, Amy. So, what we have is the region already has the worst indicators in terms of health services. So, it is the place in Brazil where you have the lowest numbers of hospital beds per person, physicians per person. Many municipalities don't have hospitals and ICU beds, then it's even worse. So, you already start the pandemic having fewer resources in those places. In addition, we have several communities in the region that have the other inequalities that I mentioned. Overall, in the Amazon region, 43% of the population don't have access to water, but in some states it's even higher than that. Then there is a completely separate health care for the indigenous populations. And those have lost a lot of the physicians in the past few years when a large program that existed in Brazil that brought foreigner physicians to work in those underserved areas was completely dismantled. So again, you keep adding those layers, right? So since this new president took term, there is not a lot of attention in terms of preserving the environment. In fact, last year we saw rampant deforestation, a horrible fire season, and this year we already overpassed the deforestation from last year, and we still have about a month and a half to go of the cutting season. So whenever you have this deforestation, you have contacts of those people that want to exploit the land with indigenous areas. We see that it's exactly in the indigenous reserves where we are seeing most of the damage. And those areas are supposed to be preserved, and then they used to be. So you have indigenous people dying because of this encounter, but on top of this, now they are being infected because the people that come into the area may bring the virus as well. So they can bring any pathogen. And it's not just deforestation. We have to remember there's also mining, which is another activity that exposed the indigenous people to that. So overall, Brazil, we have 110 indigenous areas that have been affected with COVID. We have about 7,200 indigenous people that have been infected, and the number keeps rising, and about 330 deaths that already have been reported. Now, what happens also is that because a lot of municipalities don't have hospitals, don't have beds, the health system work with a sort of regionalization scheme. So whenever people need hospital care, need to be hospitalized, there is a reference municipality that takes all those people. What we saw in Manaus, which was the first capital in the Amazon region that really had a completely overloaded of the health system, is that once the capital is completely overloaded and they cannot even provide hospitalizations for people living in the capital, they can't serve all the municipalities that depend on them. So the very high number of deaths that we observed in those areas, part of them could have been avoided if we had enough hospital services available. But above all, they could have been avoided if we provided a better response. So the community health agents, they are all over Brazil. They basically act on the community. They know the people they serve, and each team has about one physician, one nurse, and around 6 community health workers. They go to house by house to provide care, and they have very good coverage in the poor and vulnerable areas, so in the north and northeast. But again, once the pandemic started, those community health agents were not provided with protective equipment, so they can't go on the street. And they were not provided with training either. So those people that could be right there on the ground, helping to identify symptoms, helping to isolate people, and therefore helping to do contact tracing, and therefore helping to flatten the curve so we could have avoided this overload in the hospital system, they were not working. So it's not just about the inequalities. they do play a role. It's not just about the low provision of health services in the area. They also play a role, but it's about the completely chaotic response that basically exacerbated all those inequalities, all of them combined, and created the situation we saw in Manaus, then we saw in Belém, and right now, Porto Velho, another capital in the Amazon, it has more than 90% occupancy of hospital beds. So we can start hearing from this capital pretty soon. Now, I also want to make a point that the fire season is about to start in about a month or so. And if we had this high level of deforestation, the fires will come, because that's usually the process. The wood now is on the floor, whatever they couldn't sell, they're going to burn. And whenever we have the fire season, we have an increase in respiratory conditions. We have an increase in the demand for hospitalizations because of respiratory conditions. And we have an increase in the mortality of children under the age of 10. Now, this is a it's a horrible combination. An increase in respiratory conditions may make people more susceptible to a severe COVID-19 infection. So we can have an overlay of two huge problems that will create again another collapse in the hospital system. So we've been trying to raise awareness of this and try to avoid a fire season like we had last year, because this would be devastating, and the effects wouldn't stay just in the Amazon. What happens in the Amazon does not stay in the Amazon. And as we saw last year, the smoke and therefore all the particulates that comes from the forest fires, they can travel and they can go to other areas and therefore affect other people in Brazil as well.